Good afternoon, everyone. This is Olivia Marquez, and I'm a research coordinator with Health Evidence, and I'm also the research coordinator for the KTA Cancer Prevention Study. It is my pleasure today to do the webinar series. This is a welcome to our health evidence users, as well as to those who are joining us from the KTA study. Today, we will be discussing electronic cigarettes for smoking cessation. What's the evidence? So throughout the session today, we will be posting polling questions through WebEx. And your participation in the polling questions is completely voluntary and anonymous. We hope that your responses to the questions will help enable engagement and stimulate discussion throughout the session. So this is just a consent slide up here, and I'll leave it up for just a moment for you to read. Okay, and just to let everyone know that after today, the PowerPoint presentation, as well as the audio recording, will be made available on Health Evidence YouTube page and our SlideShare account. And we try to post that within at least 1 week from the session date. So the links to both of those resources will be posted in the chat section. So that's the right-hand panel on WebEx. So today we are very excited to be talking about a review that's a very interesting and trending public health issue. And we're looking at electronic cigarettes for smoking cessation. And the link to the Health Evidence dedicated systematic review page, as well as the link to the quality assessment rating, will be posted in the chat section. So you can pull up the review and the abstract, as well as the quality assessment, and follow along with us as we go through the review today. So just a few housekeeping items before we begin. Please use the chat section in WebEx to post your questions or comments. We ask that you please send your questions or comments to all participants and not just to the host, because some of you may have the same questions. If you do, it's not a problem. We will still see your questions or comments. And towards the end of the session, we'll have an open Q&A where I'll be able to read aloud your questions to our presenters to respond. You do not need to wait until the end of the session to post your questions. You can do so as we're going through, and we'll just save those questions until the end. So for your best connection today, we recommend using a wired internet connection versus wireless. And should you have any problems with WebEx, we've posted the 24/7 helpline there on the slide, and we'll also make sure that's available in the chat section as well if you're having any issues connecting or hearing today. Okay, so for your audio, if you go to the top of WebEx and click on Communicate and then Audio Broadcast, you'll be able to hear us today. And again, if you have any issues at all, the helpline phone number is posted there on the slide. So we have our first polling question today, and we're wondering how many people are watching today's or listening to today's session with you. So we'll be opening up that polling question in just a moment. And as you answer, just a reminder to click one of the responses and then make sure you click Submit at the bottom of the screen. So thank you to those who are starting to respond to that question, and I'll leave that open for just a few moments. That's great. So we're seeing quite a few people who are joining with some other people today, which is excellent, and even a few who are joining in some larger groups with more than 10 people, so that's really great to see. So this is just a special thanks to our Health Evidence team. There's a big team who brings this session and this webinar series to you monthly. As well, there's all of us who are helping to keep Health Evidence current and maintained, as well as coordinate this monthly webinar series. So we recognize the hard work of everybody here. Okay, so for those of you who may not be familiar with Health Evidence, we launched in 2005, and we are a comprehensive registry of reviews evaluating the effectiveness of public health and health promotion interventions. We provide over 90,000 visitors per year access to over 4,900 quality-rated systematic reviews. In fact, we're almost at 5,000 within our registry. So we provide full text, plain language summaries, and podcasts or these webinars where available. One of our main goals of health evidence, in addition to making evidence on the effectiveness of public health interventions more accessible, is to make it easier for professionals to use that evidence in decision making. So the value added for health evidence is that we save you time. We've done the work to screen and appraise each review within our registry. So we screen all reviews for relevance to public health, which helps to keep our registry focused, and we keep our repository up to date by constantly screening relevant databases. So at any given time, we're no more than about 1 to 2 months behind publication dates. We've done the work for you by critically appraising all reviews through a transparent process whereby you can actually click on the full quality assessment for each review and see our ratings for each of our 10 assessment criteria. So healthevidence.org also has various tools and supports for evidence-informed decision-making available online. And many of our users over the time have informed us that our tools and repository are easy and simple to use. So what we have up here is a model for evidence-informed decision-making in public health, which consists of 5 components that you can see in this diagram. So traditionally, public health practitioners and decision-makers consider evidence about community health issues and local context, existing resources, and community and political climate in making decisions about programs and policies. However, it's become more apparent that considering evidence about research may be a bit more challenging. So as such, the Health Evidence webinar series is designed to identify research evidence relevant to public health decisions and present those to you in our webinar series. So the evidence-informed public health wheel that you see on this slide illustrates the steps that are involved in evidence-informed practice. So the wheel is a guide for practitioners and decision makers to determine how to address a particular issue by systematically incorporating research evidence in the decision-making process. So there are 7 steps to this process, and today we will hear about how our presenters have worked through the first 4 steps in order to help with decision makers with the remaining of the 7 steps. So we have our next polling question here, and we're wondering how many of you have heard or are familiar with PICO-S. So again, if you can use the responses in WebEx, and just remember to click submit at the bottom. So thanks to those who are responding, we're seeing almost a 50-50 split, but a few more who are familiar with PICO-S. So thank you to those who are responding. So for those of you who are familiar, this will be a bit of a review, but for those who are unfamiliar, PICO-S is a way for you to structure your questions in a defined set of evidence-informed decision-making. So this involves defining who the population is that you're interested in, what the intervention is that you want to know about, or the exposure. So this might be a program or a service, or in our case, it's electronic cigarette use. The comparison group, if any, and that might, again, be a little bit complicated in terms of the realm of public health, as well as looking at any specific outcomes you're looking for. And sometimes we might also have a particular setting in mind, which could be school or community settings, for example. So the value of a PICO question is that when you have an issue that arises in your setting, you can use PICO-S to turn this into a searchable question, which then allows you to further articulate specific components of that question that help you to hone in on that question. So searching for relevant information related to PICO should then be quicker and easier. We have one more question here, and we're wondering how often you use systematic reviews to inform a program or service. So perhaps you always, often, sometimes never, or you may not be familiar with what a systematic review is, which is completely okay. Today, we can hopefully enlighten you a little bit on what systematic reviews are. So thank you to those who are responding. We have a range from people who are always and often using systematic reviews, which is great to see, and a few who are not familiar with what a systematic review is. And again, totally fine. We'll hopefully enlighten you to that process today. And we just have one more final polling question to ask before I give it away to our presenters today. We don't actually have a slide for this, so we'll open up our polling question. And we're wondering, before you hear the evidence today, we're wondering what your opinions or your thoughts are on electronic cigarettes use. So are they effective for smoking cessation? So either you may strongly agree, agree, neutral, or disagree. So I'll leave that polling question open for just a few moments to give you a chance to respond. So we have most so far, about 30% are saying they're neutral, and a few that are disagree and strongly disagree, and no one is strongly agreeing that electronic cigarettes are effective for smoking cessation, and a few that agree. So that's really great to see. So without further ado, I'd like to pass it off to our two presenters today, and we're so pleased and excited to have the authors of this review present on their review today. So I'd like to introduce Muhannad to us today and Robert Schwartz. So I'll pass the ball to
Rob.
Perfect. So passing that presentation along to you, and I'll let you take it away. Thank you for being with us today, Rob.
Thank you very much. Thank you, Olivia, and to the whole Health Evidence team for inviting Muhannad and I to speak today. We're really delighted to be able to present our systematic review on this highly contentious issue. And we're going to demonstrate how contentious it is, and your responses to the last poll may be an indication of some disagreement out there in the field about what we actually know about this. So it was an exciting project, and we are really delighted to say something about it to you today. I'm going to do a brief introduction to e-cigarettes and to our research just to contextualize it. Muhannad is then going to take over and run through our systematic review on e-cigarettes. I'm going to come back after that and do a little bit of contextualizing that versus other systematic reviews that have come up, and sort of summarize where we are on the question of e-cigarettes as cessation aids. And then we're going to do a little bit about the health effects of e-cigarettes as well. So we'll get going, and I'm also looking forward to hearing your questions and your comments, so please don't hesitate to put those in the chat box. So what are e-cigarettes? Well, here's some pictures of some of them, but there's a lot more varieties of that. So one thing that is important to say is that e-cigarettes are not e-cigarettes are not e-cigarettes. In other words, there are many kinds of devices, cartridges, fillings out there that all go under the same name of e-cigarette, but actually are very different in characteristics and in what they deliver, how they deliver, how warmly they deliver, etc. The basic agreed definition, this is based on the World Health Organization definition, is that an e-cigarette is a battery-powered device that heats and vaporizes a solution. The solution generally contains propylene glycol, sometimes vegetable glycerin, or sometimes a combination of those two. Flavorings, and there are thousands of flavors in which these are available now, and often, but not always, nicotine. So I will say, just for your knowledge, that currently nicotine in e-cigarettes is not legal in Canada. However, as many of you will know, it is widely available at vape shops and even at your corner store. There is legislation federally that's been proposed, Bill S5, to regulate e-cigarettes, nicotine e-cigarettes. And in Ontario, there is also legislation that has been passed but not yet proclaimed on this issue. So that is generally what an e-cigarette is. The study, the systematic review that we're going to present today is part of a study that we call ReCig, the Research on E-Cigarettes. It was funded by the Ontario Ministry of Health and Long-Term Care as a health system research fund study. It was to be taken place over 2 years, but we actually were only given a year and a half to complete. And this is our investigator team. You may recognize some of these names. Notably, you can see Tom Eisenberg from Virginia Commonwealth University, who is one of the renowned global figures in e-cigarette research, and the rest are colleagues from the various places in Ontario. We also had a large research team. Muhannad was one of the stars amongst other stars that you can see listed here. So in order to get the work done quickly, we had to hire a whole bunch of people to make it happen. Excuse me. And as with all of our work, we had a Knowledge Exchange Advisory Committee. This is made up of stakeholders, people who are actually going to use the knowledge, but also inform our specific research questions. You know, this is a bit of an alphabet soup, but basically we had people from the Canadian Cancer Society, Toronto Public Health, Registered Nurses Association of Ontario, Smoking and Health Action Foundation, Ontario Lung Association, etc. And we didn't, that wasn't enough for us. Make sure that we got this right. You know, being such a new issue, a complex issue, difficult to understand, we wanted to make sure that we were collecting all of the evidence and that we were producing here in Toronto, we were interpreting correctly. And so we had an expert panel. The names and places of work of the people on the panel are on the slide, so you can see that they came from various places, and they included people who are sort of known as being sort of more pro-e-cigarettes and people who are known as being sort of less pro-e-cigarettes. And I know that's a sort of very rough way to put it, but we did want to make sure that the experts represented different apparent points of view. These were the research questions for the entire ReCig study, and you can see that today we're going to focus on the third question, which is to determine the effectiveness of e-cigarettes as a cessation aid. We also did address each of the other three questions, and of those, we are, as I said, going to relate a little bit today about the health effects of e-cigarettes. So we have also done a systematic review on the health effects of e-cigarettes. We haven't yet published that one, and I'm just going to give you some basic pieces from that piece. We did several studies. In addition to the systematic review, which here is called a comprehensive realist-informed knowledge synthesis, we analyzed existing surveys. We recruited a longitudinal panel of adult smokers and recent smokers and looked at what was happening with them with e-cigarette use. We had a youth panel as well, and we did a social media analysis of, we did tweets on Twitter. That one was published. And there were also two more trials which were led by my colleague, Lori Zarateo at CAMH. So we're not going to be relating to most of these today. And finally, as I said, the international multidisciplinary expert panel was key for us in understanding it. In fact, until we had that panel, the findings together, synthesizing them and have a discussion, I wasn't comfortable and able to come up with some of the conclusions that you will see later on in the presentation. And here, I'll pass it over to Muhannad, and he is going to run us through the systematic review on the effectiveness of e-cigarettes as a cessation aid.
Thank you, Rob. So hi, everyone. I'm Muhannad Malas, and as Rob mentioned, I was involved in doing the or conducting knowledge synthesis for the ReCig study on the 4 questions that were listed in one of the previous slides, including the effectiveness as cessation aid question, which we will be specifically talking about today. So because of the nature of the issue on e-cigarette use, and because the field was, and one could argue, is still in its infancy in terms of knowledge and evidence, we really wanted to comprehensively review what's out there. And so what we went out to do was to collect and review all original data studies, including the ones that are published in peer-reviewed literature, as well as gray literature. So those, whether it was a policy report or surveys that was done by nonprofit groups that may not have been published in academic journals, as well as abstracts. So those studies that were about to get published or experiments that were ongoing. Because we wanted to get a complete snapshot of what the evidence says on e-cigarettes at the time. So we looked at all English language publications, and we looked at all 4 questions that were presented earlier, including health effects and cessation. And we excluded some studies, including literature reviews, so those studies that reviewed the literature, because we wanted to look at only those studies that had original data, so studies that had conducted surveys or experiments or randomized controlled trials, and we also included commentaries and discussion papers. And on this slide, you can see all the sources of literature that we collected data from or studies from, so the peer-reviewed literature sources. Some of them are very well known, like PubMed and Scopus and Web of Knowledge, Web of Science. And the gray literature sources, we also tried to be as comprehensive as possible. And when we were reviewing the evidence or the studies, to determine what to include in our study, exclusion had to be agreed upon by 2 reviewers that were blind to each other. So one of the things that we did that was, I would say, very innovative and effective in the study was using a web platform called Distiller to do all of the different steps, whether it's collecting the evidence, so everything was sort of imported into this platform, and then the review of the abstract and including or excluding studies was done on that web platform. So it really enabled us to do this as rigorously as possible. And I think one of the major challenges that we had was the fact that the evidence came from different types of research. So methodologically, there was a lot of variation out there. There was lots of cross-sectional surveys, so population-level surveys that looked at use of e-cigarettes. There were longitudinal surveys that followed a group of people over a period of time and did a follow-up after 6 months or a year to see how e-cigarette use affected certain outcomes. And there's also experiments and randomized controlled trials. So one of the challenges that we recognized early on in the process was that we needed a quality assessment tool or quality appraisal tool that would be suitable for all different types of methodological approaches, because we didn't want to use a tool that would highly rate a randomized trial and on the expense of other studies like cross-sectional surveys. So we looked at the evidence out there about how to best review the literature and appraise quality, and we decided that the best thing to do was to develop a tool that was based on a couple of well-known quality appraisal tools out there. So the QualSys tool was a tool that is used by the Alberta Heritage, or it was adopted by the Alberta Heritage Foundation for Medical Research, and we found it to be quite flexible and enabling to look at different types of evidence and studies. So we took that tool and we adapted it based on some of the principles from the Cochrane Handbook criteria. And eventually we came up with a tool that had 16 indicators, and those indicators would rate the study based on its design, based on the sample representativeness and approach, and it would also rate the study based on instrument validity or reliability, the statistical analysis that was done, risk of bias, reflexivity, and also it gave us an option to adapt the tool based on what we were looking at. So it was quite flexible, and it worked for this topic specifically. And in order for a study to be rated strong, it has to receive a rating of 0.75 to 1.0, or 75% or higher, and a moderate study would be rated between 50% and 74%, and a weak study would be below 50%. And we also were interested in looking at the issue of conflict of interest, since many of the studies that were published may have been funded by industry or by other groups that had a specific interest in this area. So we did include an indicator that would allow us to rate the study based on risk of bias, and that was incorporated within the summary score, or the final summary score for the study. And in this slide, you can see the flow chart of basically the PRISMA flow chart, which shows the entire process and the results in each process. So at the top of the flow chart, you can see that we've initially identified 2,855 studies, and then out of those 2,855 studies, about 1,500 were included based on eligibility to be included in our studies, and then from those, we extracted data from 500 studies. Again, so the 500 studies looked at all 4 research questions that we were interested in, not just cessation. And then the bottom part of the flow chart really shows the cessation data. So out of the 500 studies that we included in the knowledge synthesis, 62 of them evaluated questions related to smoking cessation, and those 62 were synthesized in terms of data and quality. So in this slide, basically what we wanted to show you here is how the studies that were included on cessation were distributed in terms of quality. So we had only 2 strong studies in terms of quality, and that was something that was expected, because at the time we knew that the research was in its infancy, and there was many issues or many questions that were not considered, or factors or variables that were not looked at in many of those studies. And so the majority of the studies that were included were considered weak in terms of quality. So 37 of them were weak, 23 were moderate. But then we were also interested in synthesizing or appraising the quality as a whole. So we looked at the grade criteria, which is the grading of recommendations, assessment, development, and evaluation tool that is used by the Cochrane Collaboration and recommended by that organization. And that tool allowed us to appraise the quality of the body of evidence per research outcome. So I'll get to into that more in the next slide. So here in this table, again, we just wanted to show a breakdown of the studies. So in terms of study type, we had about 10 randomized controlled trials included in the synthesis, and we had about 16 experimental studies. And in terms of surveys, I think the surveys dominated in terms of the largest number of studies included. So longitudinal surveys were 18, and the cross-sectional surveys were the most numerous, and there were 19 studies included. And what we were really interested in is studies that looked at cessation outcomes. So the primary outcomes for us were abstinence and reduction, so quitting smoking completely or reducing the use of cigarette use. But also we were interested in secondary outcomes, so those studies that looked or assessed impact on cravings and withdrawal symptoms. So this table really shows how, or the full results in terms of data collected and studies included. So when we use the grade results, the grades criteria to appraise the quality of the body of evidence, we looked at the body of evidence relating to each outcome in our research. So our research or our appraisal process showed that the evidence on the effectiveness of e-cigarettes as smoking cessation aid, so basically here we're talking specifically about whether e-cigarettes could help smokers quit completely. So the evidence was appraised in terms of quality as very low to low. And that was primarily because of methodological weaknesses in the studies that were included in our synthesis. And in terms of the evidence showing effects on smoking reduction, so a reduction in the number of cigarettes smoked, there was a indicator of a more positive association. Some of the studies, or based on what we reviewed, we found that the evidence was a little bit stronger, or the quality of the evidence was a little bit stronger, but it was still ranked as low to moderate. And again, this is due to methodological weaknesses in the included studies themselves. And in terms of the secondary outcomes, so those outcomes related to reduction in cravings and reduction in withdrawal symptoms, there was a lot of evidence showing that the relationship is positive. So 9 out of 10 moderate or strong studies demonstrated positive results. And that means that the majority of the evidence shows that e-cigarettes may help folks who are smoking to reduce their cravings when they quit smoking, and also the withdrawal symptoms. But again, the overall quality of the evidence, according to the grade criteria, was rated as low because of methodological weaknesses in the study. So our conclusions for this specific research question on cessation aid were that the evidence remains inconclusive. And that's because there's too much uncontrolled variation. So a lot of the studies did not consider many factors that should be considered when looking at whether e-cigarettes could help people quit smoking. And also there were issues related to whether some of the experiments and some of the randomized control trials apply to real-life scenarios. So a lot of those experiments, for example, would use a device that is an old generation device, so devices that may not necessarily be used today, or another example would be the puffing or the inhaling method would not be applicable to what actually is done in real life, or how vapors actually use e-cigarettes. So those sort of factors or variables were not accounted for in many of the studies, and because of that, it was we couldn't draw reliable conclusions from the studies that we included. But the direction of the effect seems to be positive in the majority of moderate and strong studies. And what that means is that based on the evidence as a whole and based on all the studies that we looked at, we noticed that there was a positive effect, and that many of the studies are seeing that e-cigarettes may help smokers quit smoking or achieve cessation. So whether that's by helping them reduce smoking rates or cigarette use per day, or helping them reduce withdrawal symptoms or cravings. So there is that positive effect that's being observed in those studies. And also one thing that we found was that newer generation devices can actually be more useful than older generation devices. And newer generation devices are known to be to provide the ability for the user to change certain features. So whether that's battery power or changing the liquid to contain more nicotine or less nicotine, so it kind of allows or enables that flexibility and for the user. So those were seen to be more useful in many studies. And I think at this point I will pass the microphone to Rob to talk about how this relates to other systematic reviews and other evidence out there, and how it relates to the issue as a whole.
Thank you, Muhannad. This slide says it all, and it's very frustrating, basically. And what I'm going to tell you is that even since we've published our study, the additional systematic reviews are coming to pretty much the same conclusion. The evidence to date is inconclusive. So conclusively, we don't know yet. But what, nevertheless, can we tell you, and what can we make of this? It's really interesting. Some of you may have heard and seen some of this debate in the press or even in the academic literature that respected scholars are drawing different conclusions from the same studies. So particularly in the UK, there's a group there that is promoting e-cigarettes as effective cessation aids, and there's a group in the United States that is absolutely saying even the opposite. So the group in California, led by Stan Glantz, has published a review demonstrating, according to them, that e-cigarettes actually demote cessation. But most everybody does agree that there is insufficient, there are an insufficient number of high-quality studies as we found. The emerging evidence does suggest that the answer to this question is nuanced. I do want to point out, because this report by the Royal College of Physicians in England has received a great deal of attention and is being used widely to suggest that e-cigarettes are effective cessation aids. And I think this is a case of misinformation and interpretation, and I just want to run you by quickly my analysis of what happened there. So in the press release for that report, it said that e-cigarettes are likely to be beneficial to UK public health. Smokers can therefore be reassured and encouraged to use them, and that they're much safer than smoking. So that was the press release. I said, well, I want to see what does the report actually say. And this is the summary, right? Sort of the executive summary of the report says e-cigarettes appear to be effective when used by smokers as an aid to quitting. It says that they're currently not made to medicinal standards and that they are probably more hazardous than NRT. And the third point is the most important here, because it says it's important to promote the use of e-cigarettes, NRT, and other non-tobacco nicotine products as widely as possible as a substitute for smoking in the UK. So it doesn't, it looks a little bit different in the summary than it does in the press release. And then when you go into what the report itself says, it is even weaker, okay? It says that there's a suggestion that e-cigarette use is likely to increase the proportion of smokers making a quit attempt, but appropriate evidence is not yet available. And that's really different than the impression that you get from reading the press release. And it says that it's not yet clear that the people who make an attempt to stop smoking are more likely to succeed. So, what the report actually says is weaker than what the summary of that report suggests, and certainly much weaker than what the press release suggests. In fact, when you look at the evidence upon which the Public Health England report is based, it would lead you to the same conclusions as ours. And these conclusions are somewhat nuanced, okay? Basically, what does all this mean? It doesn't mean that e-cigarettes are not effective. It just means we don't have sufficient good quality evidence to say that they are. Okay, but from what we know so far, it would seem that some smokers using certain kinds of e-cigarettes in certain ways may quit smoking. Okay, on the other hand, some smokers may become dual users, which may or may not lead to cessation. And by far, from what we see in the studies and from our own studies, our own research, by far most smokers who try do not become vapors and do not quit. When do they work for cessation? Some studies, including our own, and this is inconclusive, this is emerging, but it suggests that you're more likely to quit smoking cigarettes by using e-cigarettes if you use cigarettes daily, if you have nicotine in your e-cigarettes, and if your purpose of vaping e-cigarettes is to quit smoking. So, that sort of makes intuitive sense. So that, that is basically what we had to say about e-cigarettes and cessation. based on our review and on the review of subsequent evidence. I'm going to go quickly through some of the health effects of e-cigarettes because that's the other really important question that people have. And just to say that the bottom line is that the evidence of the potential health effect is sufficient to suggest that anybody who is not a current smoker of tobacco cigarettes should not vape electronic cigarettes. That is very clear. Okay, the experts that we invited from around the world with different points of view generally on e-cigarettes had very clear consensus on this issue. If you are not a smoker, don't even consider picking up an e-cigarette because they are not benign. It's challenging to assess the health effects of e-cigarettes because there are actually no standards for acceptable levels of toxic vapors or aerosols that are ingested into the lungs. So this is a key problem. What we see is a lot of people and studies coming out and saying, well, there's far less toxicants in the aerosol from e-cigarettes than in the smoke from tobacco cigarettes. And, you know, there is widespread agreement about that. What we don't know, though, is the absolute health effects of the toxins that remain in the aerosol, and there are toxins in those. And, you know, again here, the findings are nuanced. And, you know, part of the problem with the research to date is, as I said, an e-cigarette is not an e-cigarette, it's not an e-cigarette, and the studies are done on certain e-cigarettes. So you can't generalize to all e-cigarettes. And, you know, they're done using different e-cigarettes, using different etc. You know, what we do know, and the bottom point here, I really do want to make an important thing. The United States Surgeon General came out with a report recently on vaping and youth and strengthened his previous conclusions about the effects of nicotine on brain development. So previously, the Surgeon General has said that that the evidence is suggestive that nicotine affects brain development. The recent report is stronger than that. There's more evidence now, and that has led the Surgeon General to say that youth, you know, prior to the age of 25, when the brain is determined to be fully developed, should not be using nicotine e-cigarettes or nicotine in any other way, for that matter. We don't know the long-term exposure effects because people haven't been using these things regularly for long enough time. That's clear. And, you know, these are the kinds of things that have been found in various studies, carbonyls, TSNAs, impurities. Particulate matter is very interesting. The small particles coming from cigarette smoke, PM2.5s, we have measured very high levels of PM2.5s at vaping expos, even higher than the levels that are found or were found in smoky bars from smoking cigarettes. Now, we don't know yet exactly what are the health effects of that particular particulate matter. It's the same size particle, but it's made up of different things than the cigarette one. That's something we're looking at very closely now, working with colleagues who know more about the physical effects of these particles. There's some literature about the passive exposure to e-cigarettes, and basically it's the nicotine and the small particles that are of concern. The nicotine particularly of concern for pregnant women and for young people. E-liquids and vapors do have some cytotoxicity, and this depends largely on the battery output voltage, how hot you are heating up the e-cigarettes. In terms of the actual health effects, the evidence is contradictory right now on respiratory effects. Interesting to look at the perceived risks of using e-cigarettes. This is, you know, one of the dilemmas in health communication. The perceived risk of using e-cigarettes is relatively high, and if you're a smoker and you're perceiving e-cigarettes as being, you know, quite risky, and that might prevent you from actually trying e-cigarettes in order to quit. And that is a potential problem. On the other hand, we do want to communicate that e-cigarettes are not benign, and if you're not a smoker, you shouldn't be using them. So, you know, there is a challenge in perceiving the problem. So what are the real health effects as opposed to the perceived health effects? Is vaping into the lungs perceived per se as problematic by the general public, by the tobacco control community? And are there sufficient numbers of people that matter that are sufficiently concerned about this? So it is a question of reframing the problem. So is the problem that people are smoking tobacco cigarettes and therefore it's better that they vape? Or is the problem that vaping in of itself causes health problems? And, you know, it seems that e-cigarettes can be both a problem for non-smokers and a solution for smokers. This makes public health policy making rather challenging. Should e-cigarettes be promoted as a cessation aid? Well, there are lots of reasons why yes, and there are some reasons why no. You can see them up here on the slide. The potentially huge reach of e-cigarettes as compared to other forms of supporting tobacco cessation is what is suggesting to people in the UK in particular that this could be a transformative occurrence in tobacco control. Because these things seem attractive, et cetera, they're available all over the place. Therefore, masses of tobacco cigarette users might be able to pick them up. You know, the challenges with promoting e-cigarettes as a cessation aid is that it's hard to reach, you know, that many smokers without actually encouraging uptake by non-smokers. So it's a dilemma that policymakers need to deal with. So should we apply here what I'm calling the anti-precautionary principle? So if e-cigarettes are less harmful than cigarettes, and if e-cigarettes can help some people quit smoking cigarettes, but we don't know for sure for whom, when, and how, why not err on the side of anti-precaution and promote e-cigarette use among smokers? I'm going to go over that slide. If you're a policymaker, here are the policy options that you have in front of you. And the ones that are marked with X's are the ones that are or are about to be implemented in Ontario. So restricting e-cigarettes to adults is already in place. Minors cannot purchase e-cigarettes legally. To regulate their promotion, so there is legislation in place, not yet proclaimed in Ontario, to do that. And banning vaping in public places wherever cigarette smoking is not allowed. Again, that one is in the books but not yet proclaimed. But, you know, other ways to regulate e-cigarettes haven't yet been considered. You know, so should we think about banning all or most flavors so that these are not attractive for youth who should not be using them? Should we regulate to assure that they provide enough nicotine in order to be able to help smokers with their withdrawal symptoms and their cravings, and to help them quit using regular cigarettes? We certainly need to regulate to decrease safety and health risks. There was another report in the paper this morning about another e-cigarette that had exploded in somebody's face. And then, you know, the other ones down at the bottom are restricting sales to licensed vape shops, and having a complete ban on sale or use. So those are some of the policy options that might or could be considered. And I'm going to end here with some take-home messages. Non-smokers should not vape. There are low levels of toxicants in e-cigarettes with unknown long-term health effects. Vaping is almost certainly far less harmful than smoking. Some smokers using certain kinds of e-cigarettes in certain ways may quit smoking. And until now, e-cigarettes are not the panacea for helping smokers quit. So what's next? Regulatory policy that can do these things. And with that, I am going to turn it back over to the host.
Thank you very much, Rob and Muhannad. That was a really great presentation, and I appreciate all the aspects that you touched on, because this is not an easy topic to present on given the evidence, and I can definitely appreciate that doing a review on studies that are mainly weak in methodological strength makes things very difficult and hard to present and make sure that it is presented accurately. So I know that all of us really appreciate having the authors here with us today to explain the evidence to us, as well as the health effects. So that's really great and appreciated. We have a few questions posted in the chat box, which I'll go over in just a little bit, but I'll also open up our polling question. So this is the same polling question that we had posted before the presentation. So now that our attendees have had a chance to hear the evidence, we'd like to open up that same polling questions and ask if electronic cigarettes are effective for smoking cessation. So perhaps a few of you have changed your thoughts, and maybe it's the question and it depends. So again, that neutral response might be a little bit appropriate here, maybe given our evidence. So we have a few people who are responding and saying they're a little bit neutral, and again, a few people who disagree and agree. So a contentious issue that we appreciate your presentation. So just the slide that's up here, we see that we have the model for evidence-informed decision-making again. So we appreciate that now hearing the evidence really helps to fill in that kind of purple bubble that we see in the diagram. So interpreting that evidence and being used that to apply in practice. So just a few questions I will pose to Rob and Muhannad now that we had from earlier in the presentation. So I'll read through a few of these, and again encourage all of our participants who are with us to continue to post any questions in the chat section, and we can read those aloud. So one of our first questions that we had, and maybe this will go to you, Muhannad, was a question from Renee, who's asking, how did you perform the quality assessment for conference abstracts? So for the conference abstracts, did you also use the QualSys tool or the Cochrane tool or a different one?
That's a good question. So what we did with the abstracts, the first step was to contact the authors and ask for a draft publication or more data or data tables that we can look at. And unfortunately, in the majority of cases, nothing or not much was provided. So in that case, the abstract was appraised according to the same criteria, and because the abstract lacks a lot of information, it would not have been rated as highly as if the data was available. But in the cases when the data was available or the researcher provided some data tables, then we would add that to the abstract, and then we would still, again, apply the same criteria, and those that provided more data would probably have had higher scores in terms of quality appraisal. But so that was our first step. Yeah, and I'm not sure if that answers the question. If it doesn't, feel free to post a follow-up question. Yeah.
For sure, that's great. Thank you very much. So I have another question from Renee, for two questions that maybe we can combine into one. And they're asking how researchers, or were researchers who worked for big pharma assessed as a conflict of interest? And that's specifically for big pharma, as many studies may not consider pharma as a conflict of interest.
Yeah, so so any study that was funded by an industry, whether it's the pharmaceutical industry or it was the tobacco industry or the e-cigarette industry, because there's a lot of independent e-cigarettes, or not independent as in they're not related to tobacco, but they are groups or industry groups that are advocacy groups for e-cigarette use. So all of these were flagged as, there's potential for conflicts of interest. And I think I see another question here about whether these studies were excluded. This question in the question box is relating to tobacco industry research, funded research. So no, these were not excluded, but within the quality appraisal tool, we had a particular indicator or question that evaluated risk of bias, and that was particularly to research bias. So we looked at whether there was any biases that were introduced to the research based on, you know, whether it's a sampling or whether it's lack of or instruments, validity instruments or reliability instruments were weaker than they should be, or whether there was some information that was withheld and not disclosed. So all of these variables were identified and appraised, and then if those things were not addressed as expected, then it would affect the score. But also, there was the criteria that we had enabled the researchers, so in that case it was me and two of my colleagues, to actually downgrade a study based on, so let's say a study did everything so well, but then there was one particular issue that was a major threat to the validity of the findings, so I could downgrade that from strong to moderate. But then using the web platform, the web-based platform that I mentioned in the presentation earlier, it allowed us to, so in the case that if I said this study has some major threats to validity and because of that it should not get a strong assessment, it should get a moderate or a weak assessment, then the other reviewer would have to give exactly the same rating. Otherwise, it would be a sort of the website or the web-based platform would flag it as an issue, and then we would sit down together. You know, the entire team would sit down together and discuss whether the study should be, or what rating it should get. But in those cases, in the majority of the times, two reviewers, so myself and my colleague, and we were blinded to each other's appraisal. We would often downgrade the study exactly the same way, and that showed that it was consistent and systematic and rigorous. So that's how we approach those particular studies with a conflict of interest.
That's great. Thank you very much, Muhannad. That's definitely a topic that complicates this issue and the research that we're looking at, so it's great to hear you touch on that with detail.
Yeah, and particularly because a lot of the studies were funded by industry. So if we excluded all of them, then we would be excluding a large body of evidence that in some cases provided some useful data. So we wanted to be very careful there about making sure that the data that we're looking at was as comprehensive as possible.
Definitely. That's great. Thank you very much. So Renee had another question who was asking, with regards to the data from the review, were you able to separately studies using e-cigarettes containing nicotine and those without nicotine?
I'm just trying to think here because we did the review for 4 different questions. So I know for the health effects, we definitely did that. For cessation, it was one of the, so we did look at specific features in the study, so whether it was it used a nicotine-based e-cigarette or whether it used a first generation or second generation e-cigarettes, and all of these were also incorporated in the quality appraisal. So for example, if a study compared users of e-cigarettes without nicotine to those that do not use e-cigarettes, then we would potentially sort of identify the fact that there was no nicotine group as a comparison group as an issue there, because if we're looking at the cessation as a question or as an outcome, then we need to look at whether there's differences between the nicotine-based products and the nicotine the non-nicotine containing products.
Yeah.
So
I'll just add that generally in experimental studies, they would be using the nicotine e-cigarettes as the experimental group and non-nicotine as a control. In the population surveys, they would ask about whether there's nicotine in it or not, and the groupings of those, the responses to those are not always very reliable. It's a very good question.
Especially since people often do not know whether the product that they have contains nicotine or not.
Exactly.
Yeah.
That's great. That's helpful. Thank you very much. So we had another question from a user who, with regards to Bill S5, which I'm not sure if you're familiar with, and they're asking this, so Bill S5 seems to let some lifestyle promotion to adults. What do you think about this and about the potential effects on non-smokers, specifically youth?
Yeah, I think that the entire question of regulating promotion is very challenging, and that this is, one of the key challenges that are faced. As I mentioned, how do you restrict promotion in a way that you don't encourage non-smokers to use, but you still don't discourage smokers from using? And I think, Bill S5 is only a proposal. It's going to undergo a lot of discussion and consultation. And I think what comes out at the end of it may not be even similar to what it is looking like now.
That's great. Thank you. Thanks, Rob. So we have another question that's saying, you say that most smokers who attempt to quit with e-cigarettes don't end up quitting. The same is true for all currently used cessation aids. So any numbers, do you have any numbers to share about what the success or failure rate actually was?
Yeah, so that's another good question. They're all good questions. The Public Health England report that I talked about, a lot of it was based on a study that looked that compared e-cigarette and NRT. And the effectiveness was actually about the same in their studies. So one might argue that if with NRT, say for example, 15% of people are successfully quitting long term, and you get the same rate with e-cigarettes, but e-cigarettes have a bigger reach, then you're better off promoting e-cigarettes. But the precise number, the precise proportion of smokers who are going to quit using e-cigarettes is so dependent on so many things. What are they using? How are they using? How long are they using it? Are they being counseled, et cetera? So I think it's premature to come up with a specific effectiveness rate.
That's great. Thank you, Rob. We have another question that's relating to e-juice. So the question is, I recently read some information from the USA indicating they had studied all levels of e-juice. The results indicated that even those that specifically indicated nicotine-free actually contained a low level of nicotine. So did you include any testing of e-juice at all?
Well, that was not part of our study, no.
Okay. Thank you very much. And another question is, in another presentation on this topic, it was brought forward that most smokers who use e-cigarettes continue to use tobacco cigarettes, albeit at a reduced level. However, the reduction in harm from using e-cigarettes versus tobacco cigarettes is only realized if people quit tobacco completely. Did you come across any of these nuances in your research?
Yeah, absolutely. In the longitudinal study that we did, we looked at what proportion of people who had started using e-cigarettes, and these are all smokers, continued to use e-cigarettes conjointly with regular cigarettes or exclusively, et cetera. So there was a lot of co-use of e-cigarettes and cigarettes. But you have to be careful interpreting that because it may be a journey. So some of the people who are co-using may eventually quit regular cigarettes and only vape, whereas others, may continue to be co-users for a very long period of time. It's a tough question. We don't know enough about it, and certainly I would agree with that conclusion that if you are continue to smoke cigarettes, even at a reduced level, you are not likely reducing your harm very much at all. There's been evidence for a long time that even low-frequency use of cigarettes is very harmful, and there's another recent study that confirmed that once again.
That's great, thank you. So we have another question that maybe the difference we see is not only the product, but mostly what the patient does with it, whether they intend on tobacco cessation or only harm reduction, either unique or dual use. So maybe that's a bit more of a comment from our participant. If they have a further question, maybe I can get them to clarify on that.
Yeah, well, that does confirm what we found in our study, and other studies have found the same thing, actually.
For sure, definitely. So our next question is, and I think you had touched on this briefly, but the current guidelines, maybe if you could review the current guidelines and age restrictions on e-cigarette use in Canada.
So, across Canada, there really isn't anything at the federal level yet. That's Bill S5 has just been introduced to the Senate, so that is just under discussion. In Ontario, which I know, and I don't have the other Canadian jurisdictions in front of me, but in Ontario, the only thing that is effect is the ban on sale of e-cigarettes to minors. Other e-cigarette regulations, as I say, have been passed in legislation but not proclaimed for various reasons, and it may be that at this point Ontario is waiting for the federal government to finish their own policymaking process, but the other two restrictions would be on vaping in public places where cigarettes are not allowed, and on point-of-sale promotion of e-cigarettes.
That's great, thanks. And so another participant, and this is maybe again a bit more of a comment if you want to elaborate, but what's worrying some is that someone who is trying and using e-cigarettes without any limits because they think it's not harmful may be raising their nicotine dependence because there's no information on nicotine absorbed through e-cigarettes. So I think you had kind of touched on that a little bit already, but I'm not sure if you have any additional comments related to that.
Right. Well, if you're a smoker and you're trying to use different concentrations of nicotine to get off of smoke, you're already addicted to nicotine. The potential advantage of e-cigarettes is that you can calibrate the amount of nicotine that you're getting and gradually reduce. That's the theory. And some people, anecdotally, and also in some case reports, actually succeed in doing that. But if you're a non-smoker, you ought not to be picking up e-cigarettes at all because you will likely become addicted to nicotine, and that's something we don't want to see.
Definitely. Thank you very much. And then we have one last question that might be a little bit large, and we've touched on a bit already, but again, if you want to elaborate a bit. The question is, what were some of the confounders and limitations in methodology in the reviewed studies that were mentioned?
Muhannad, do you want to take that one?
Yeah, sure. I can do that. Okay. So I guess it would depend on the type of study. So let's say with RCTs, we only had one RCT that was rated as strong. So the other RCTs were all, the majority of them were either moderate or weak, and that's because often they would not look at long-term effects. So the study would look at effects or outcomes, within the first 4 weeks or maybe 2 months, but it was very, very rare to see studies that looked at long-term impact. So looking at 6 months later or a year later, often we had problems or observed problems with the sampling. So there was a lot of many studies that used convenience sampling, and that was a problem with cross-sectional surveys. So often studies would recruit participants from e-cigarette forums online, and there were issues with that, particularly because obviously the group that was being studied were not representative of the general population. And there were also a lot of issues with statistical analysis, so more technical, I guess, limitations or problems on a side of the analysis, particularly for surveys. And we were very careful to look at that, and often we were even, so if there was a study that had because often it would be a new study and then there would be other researchers that would publish whether a letter or discussion paper just critiquing the methods of that study. So we would actually look at all these different inputs and different perspectives and then look at the analysis that was done in those studies and then rate how the analysis was done. So there was often issues with that as well. So there were particular biases that were identified in the analysis, the statistical analysis, I would say. And with experiments, also I would say some of the major issues were related to sampling. So often the experiment would look at a very small sample, so it would be a handful of people or maybe a dozen people. So there wasn't a good sample size to draw good conclusions from. And as I mentioned in the study, there were particularly variables around how vapers use e-cigarettes. So often the study would use, let's say, a puffing procedure that would be of a certain length. So sometimes we notice that studies would have a puffing duration of over 10 seconds. And generally we know from data from studies that looked at patterns of use that a puff from an e-cigarette would not be longer than 10 seconds. So, and it was a common problem identified by a lot of vapers where if you take a long puff, then you would end up getting a what they call a dry effect. So it would, because I think that it would affect the heating of the e-cigarettes that they're using. So things like that where often the researchers did not actually use a real case scenario of how to use an e-cigarette. And then we flagged that as a problem because it doesn't really answer, it answers the question, but based on procedures that are not realistic. So those are some examples of how methodologically problematic some of the studies, or many of the studies, were.
That's great. Thank you very much, Muhannad, to touch on those important issues and aspects of this systematic review. We have another question here that's come in that's saying, a recent systematic review in BC cited an American study that demonstrated that adolescents' smoking uptake decreased more in states that allowed e-cigarette sales to youth than those states that banned e-cigarette sales to youth. Do you have any comments on this?
Yes, I do. So one of the things that I've learned from this particular review on e-cigarettes is that we need to be so careful about relying on any individual study. And I can't, I haven't looked critically at the study in question here, but some questions that I would ask are, did it control for other variables that might have led to greater reductions in youth smoking in those states? Because there are all kinds of things. Some states have increased the minimum age, some states have increased taxes, etc. Secondly, we know that rates of youth smoking have decreased actually quite substantially in many states and also in Canada with no relationship to e-cigarettes. Is e-cigarettes actually the reason why there's been further reduction in those particular states? Thirdly, there is a counter-argument. There are now several studies suggesting, and again, it's not conclusive, but suggesting that those youth who pick up e-cigarettes are more likely to start smoking cigarettes, even controlling for their supposed susceptibility to smoking cigarettes ahead of time. And finally, the fourth point that I would make about that is that you know, if by allowing e-cigarettes to be sold to youth, more youth are uptaking e-cigarettes than would not have uptaken e-cigarettes or cigarettes, then you have the problem of actually addicting a large cohort to nicotine and also exposing them to the direct health effects, which are largely unknown, but we know that they're not benign. And, you know, the problem of nicotine for young adults and adolescents prior to the completion of brain development has been, you know, made quite strongly in the recent Surgeon General's report. So, you know, this may be, if this is true, you know, that actually in those states there's less cigarette smoking, the overall analysis of the public health consequences of that would have to be looked at very carefully.
That's great. Thank you very much, Rob. Those are great comments and questions to go along with that point. So I'm just looking through the chat and Q&A section. I'm not seeing too many more questions coming in, although we do remind attendees that they can continue to post any questions they have in the chat section. So for the time being, we'll move ahead. We just have a few more polling questions for our attendees. And we're just wondering if the information presented today was helpful to you. So again, you can select your response in WebEx and then click Submit. And we'll leave that open for just a little bit longer, and in the meantime, I'll move ahead to our next slide. So if you did find the webinar today helpful, and if you're wondering what you can do now, we just remind participants that we invite you to visit our website where we have a repository of over, I guess we should update our slide here, almost 5,000 quality-rated systematic reviews, and health evidence is free to use. We invite you to register as a user. As registered users, you can receive monthly tailored registry updates tailored to your topic area interests, and our monthly newsletter, so you can keep up to date on upcoming events and what our next monthly webinar will be. We invite you to tell your colleagues about health evidence and follow us on social media. We invite you to follow us on Twitter, Facebook. We're also active on LinkedIn, where we post review-related tweets daily. So we pick a review from our registry and we disseminate the evidence to you. And all of that is checked for accuracy and quality by at least 2 reviewers within our suite. We encourage your organization to use health evidence to search and apply review-level evidence to inform decision-making. And we always invite you to contact us to suggest any topics or provide feedback for future webinars. And with that, we have one last polling question where you can select multiple responses. But what are your next steps? So perhaps you may be interested in accessing the full-text systematic review that was featured today to access the quality assessment for this review. Consider using the evidence or tell a colleague about this evidence. It may be that some of your colleagues weren't able to join our session live today, in which case we do remind you that we will be posting the audio recording and the slides for this session on YouTube and SlideShare. So we should have those posted within a week after this session. So again, thank you very much to those who are responding today. And I'm not seeing too many more questions come in, but again, we do invite you, if you do have any more questions, you can email info@healthevidence.org, and if possible, I can forward some of those questions to our presenters as well. So Rob and Muhannad, I'd like to sincerely thank you for joining us today. This was such a great presentation and such a great topic. To have the authors actually present on the evidence is just so important. And we thank you for your great presentation today. So with that, I would like to thank you on behalf of Health Evidence and ask you if you have any final comments that you would like to leave with our participants today.
Rob, would you like to go ahead? Or?
No, thank you very much. I really appreciated the opportunity, and happy if people would like to get in touch with us at the Ontario Tobacco Research Unit, www.otru.org, or with me directly. We are continuing to follow and to study e-cigarettes, and stay tuned.
Yeah, and thank you for hosting this session and for inviting us to speak about this, about our review. And again, it's a great topic to discuss in these forums. And I'm happy to answer any follow-up questions about the study that we did and the methodology, or if folks are doing, a similar study and want to learn about how we approach our systematic review, I'm happy to share information on that as well.
Thank you very much today, and to our participants, we thank you for joining us, and have a great afternoon.